And there's no running charge cost for your Part A, but there is for Part B. For most people, they pay $202.10. I'm not sure on the last two digits, but it's quite a bit a month, and it's taken out of your Social Security disability check. So this is one of the things that we have seen is that many people are not aware that they could have their Part B paid for by their state. And it's not like you're going to get somebody knocking on your door saying, oh, by the way, you're overpaying for your Medicare Part B. It's something that you need to seek out. So, as a general rule, if you have a Social Security disability check of $1,710 a month or less, and you don't have any other income, then you should, and you're paying for your Medicare Part B, you should check this out. So you might have a check now that's around 1900, and your Medicare Part B is taken out. So you're at 1900 for your check, then you wouldn't qualify. But if your check is around 1700 and after Part B it's in the $1,500 range, you should definitely look into it. The Extra Help program is a no-cost service. You apply, it's provided by your state, and that could save you that money. That is low-lying fruit for anybody out there to pick up a nice return on investment. Um, we're going to come back to Medicare and some parts of it in a minute, but the next one is medications. And this applies to anybody who's got a medication that is out of pocket that they have to pay for, whether you are not approved for your disability benefits or approved. There's two ways to reduce or eliminate the cost of a medication that we know of. And we know this because there's a lot of people here that take a lot of medications. First one is a process called prior authorization, where you go to the doctor and it could be you have to pay, let's say it's $100 a month for this medication, and you ask them for a prior authorization to change the classification of the drug so that it could go from like a tier 3 to a tier 2 drug. And that might be super techy for you, but if you just look into the prior authorization process and how it works, and bring it to your doctor. This is a standard practice. It's nothing special. They'll know about it. At the end of today's show, Nadine is going to put um, in the chat links to key features, and this is one of them. So it's the prior authorization process. The second one for medication is a program called Patient Assistance, where you can apply for financial relief from the manufacturer. So we'll also include a link to that, which is an interview with two advocates here that have used the patient assistance program successfully to reduce their medication costs. So it's first-hand info. All right, the next thing is going back to Medicare coverage, and we're in the middle of the summer here, and the Medicare opportunity to change plans comes up in October for most. It's mid-October to December 7th, but new plans are released in late September, early October. And what I'm sharing with you is something that you can look at when that opportunity and that window comes up, which we'll do more events like this to inform you. So most disability recipients are on a Medicare Advantage plan, which is a Medicare Part C plan. And Part C has prescription drug. It also covers those same comparable parts of A and B. It's everything bundled into one. And in order to have a Part C plan, which most of you do, you need to be in Part A and Part B, either paying for Part B or having your state pay for it. Now, these Part C plans, Medicare Advantage plans, are have extra benefits in them. Typically, they're low to no premium, but they have extra benefits to attract you to join. And especially if you're in competitive marketplaces like in the Florida market or Texas or different areas that are densely populated. And what you can find in some of these plans is like dental, vision, things that maybe you're paying out of pocket for now, um, and hearing assistance. And in addition to that, one thing that I encourage people to be aware of is you may have a chronic condition now, or maybe you have developed one. And there's two types of special Medicare Advantage plans. They're called special needs plans. And one type of plan is for an individual that has a condition. That condition is commonly diabetes. Diabetics in most areas, there's a special need plan that has extra benefits above and beyond what a normal plan would. Um, or they have them for cancer or stroke or different conditions. They vary in area by different company that's offering them. The other special need plan is for individuals that have lower income. Like I referenced in the beginning, the extra help program for $1,710 a month. Oftentimes that threshold of income, if you're below that, you can get into a special needs plan based on your income. So two ways to get into a special needs. One is your condition. Two is your income. If you don't qualify for either one of those, then you're just going to be a match for a regular Medicare plan that does have benefits. So I have a example here that I want to share on the screen just to give you an idea of what some of the possibilities are. So this is a special needs plan from Humana, and this is just an example, and they vary by zip code. So this is not going to be available in every area. Um, but this is a dual eligible special needs plan for somebody that meets the income criteria. So if you have Medicare, Medicaid, like that $1,710 a month or lower, then it's possible you could qualify for a plan like this. But for this specific plan, you would need to be in that area. So I'm going to hit the highlights here. You can go to, doctors, primary care and specialists for like no out-of-pocket cost. Most of your tests are zero. So you see all these zeros here: inpatient hospital coverage, ambulance, primary care, it's all zeros, specialist zeros. So it really eliminates your cost. But these plans have exceptional benefits typically in the area of like dental. So like this one right here, I don't remember exactly what it is. This one has $4,000 a year in dental. I mean, if you have to use $4,000 a year in dental, God bless you. That's a lot of work. Um, and then the other standout feature is a lot of these plans have a healthy allowance option card, which this one is $355 a month on a prepaid spending card. So it's $355 a month that you have allocated, and you can use the money for groceries, utilities, rent. So that's a big hit financially. So again, why am I encouraging you to do this? This is different ways to save money and maximize your benefits. Is, maybe when you started with your disability benefits, um, you didn't have diabetes and you developed diabetes and you fall into a plan like this. Or maybe your income level changed. Maybe you had a part-time job and it dropped off, or maybe the category for income to qualify for this plan changed in your state. There's so many variables that you don't know unless you invest some time to do the review yourself or have somebody here do it for you. Okay. Um, yeah, so if you're on a fixed income, $355 a month, I think for anybody would be a big help. Okay. Um, as Nadine said, we're going to take some questions at the end, and then you'll have the opportunity to come in and actually join Nadine and I here. There'll be no charge. It's just like, you know, sitting around in our living room asking questions. So anything disability related, we'll set a few minutes aside. So if you want to come in and join us, we'd invite you to do that. All right.
Ryan, I have a question for you because I'm also wondering, like, what if one of our members, they just found out that, oh, there's actually extra help and they've already been paying for Part B for quite some time. Once they knew about that, is there going to be some sort of like back pay for what they paid? I think that's a common question.
No. Mm-mm. No, it's on you to make sure you stay up to date. Yeah. Be nice, but the only exception to that, I mean, that's not even the same thing. We had an individual the other day that we were working with, Nadine, that had they had their Medicare Part B. They weren't paying for it, and then they started taking it out of their check, and it was a mistake on Social Security Medicare part, so they refunded that. That's
But that's a different story.
that's a
Yeah.
totally different story.
Yeah.
Um, all right. So we have put together here a what we call a toolkit at the Disability Digest, and this is one of the links that Nadine will share with you. Um, Actually, you know what? I forgot. Before we get into the toolkit, I just want to hit on a resource that I feel that everybody should take advantage of. And what's up on your screen right now is a website here at the Disability Digest that explains what the Centers for Independent Living are, and how they can help you. So, Center for Independent Living are government-funded agencies. They exist all throughout the U.S. And they provide core services like treatment help, food and financial services, legal aid, housing, transportation, advocacy, and support groups. Um, and this website will be included at the end, but even here, I am in a very remote state of Vermont, and I use this as an example. There's like 636,000 people here, but we have these centers for independent living like throughout the state where people can access them. And all states are like this. If you look at, like a Texas or a Florida. So what this will allow you to do is to come in here and pick your state. Let's take Texas, for example, and look at all the ones that are available and contact the one that services your area. It might not be right next to you, but every county is covered. And these are really a must stop for anybody who is not just a disability recipient, but they service the elderly, and they have like really good programs. And each Center for Independent Living will have some unique programs. Like the one in Burlington here has fuel assistance, has a domestic violence program, which there may not be. Like, I don't think you're going to have fuel assistance in Houston, Texas, because it doesn't get cold that often. Um, but find your local Center for Independent Living. If there's a specific service that you're looking for, um, be polite and professional in how you contact them. Each organization provides their contact information. Um, and I would encourage you to submit if there's something specifically that you're looking for in advance, like housing is a common one. They have like housing counselors. They're not real estate agents, but they'll help you find housing. But put it in writing, what you're looking for, what your budget is, where you would like to live, where you don't want to live, and do you want to be on the first floor because of mobility issues, or you can live on any floor, things like that. And send it in and follow up because these are organizations that are very busy because they do great work. And so if you get in touch with somebody and you're well organized, it's going to be the separator. That's where we've been able to help people get the best results. Okay. Centers for Independent Living. That will be one of the links included at the end of the show. Okay, now, okay, we have this toolkit. This will be another thing that you'll get at the end. This toolkit has different services in here, like 211, call 211. And there's a variety of services that are available here that are dialed into your local area, different than the Center for Independent Living. So I'd encourage you to check that out. Um, I encourage you also to look at what your county has on the county level, because there are county services, there's funding in the local county, and this isn't something that you can really, I haven't found a way to dial in on a national level. So look at what your county services have, and you can trace back to that through your Center for Independent Living by asking, listen, I'm looking for XYZ assistance. If you don't have it, do you know another organization that might? Okay. Um, Cell phones, they're not a luxury anymore. They are a like required service, and you can get some assistance through the emergency broadband benefit service. That will also be on here. So you click, go through a tour and figure that out. Or maybe you're paying for your cell phone now and you can get a different, better plan based on your situation. Find help. A lot of these are self-explanatory. This gives you an idea of what to say and do. So just check this out. Um, your local congressional office also can be of assistance. If you are, especially if you have a disability benefit situation that you're having a hard time resolving. Like we've used them for individuals that have had cases that are stuck in the decision process, for people that have had back pay that has been delayed by, you know, unusual amount of time. Or if you've gotten an overpayment or some other challenge that you've had that's benefit related, you can use your congressional services. So I'm throwing a lot at you here because there really is a lot out there that you can take advantage of. And just a reminder, we're going to start a Q&A in a minute, but one of the last things I want to share is one of my additions to this. That is a missed benefit is the ability to earn extra income. I'm going to share a story with you. I met with a husband and wife earlier this week. The husband was going through the disability approval process, and the wife was a disability recipient. And I'm going to kind of paraphrase this and get to the point quick. Long story short, is she had been given advice that she was not allowed to work on her disability benefits because she would lose them. Boom, done, right? Meanwhile, she could have done some work at the same place where she had worked before doing something that was super limited, but she could earn like an extra 10 grand a year. So over 4 years, she's had this misinformation. Cost her like $40,000. Breaks my heart when I hear this stuff. People get information from other sources. So we'll put the regulation about how much you can make and keep your benefits below, but it's $1,210 a month. So if you, one point here, if you hear of something and you're taking that advice without actually seeing a regulation or a plan or something in writing from an agency that supports it, I just caution you. That's one of the things that we really strive hard here at the Disability Digest is to provide you information that is supported by like the regulations. So it's not like guesswork. So back to the work thing. It's definitely fine to work. We encourage it to work. We've done a lot of events like this where we've had recently Salah Bastille about, you know, finding ways to get back into activity and find your purpose in work. And for everybody, it's not work. They're just not able to work. They don't want to work. They don't have to work. But finding something to do to keep you engaged, moving forward, being the best you. I truly believe we're all here for a purpose, And it may sound like I'm off on a tangent, and I actually probably am, but it does tie back to work. So that's another benefit that a lot of people are missing out on. So, and if you want to go back to work full time, that's a whole other issue. There's different programs you can do that. But I just, first things first, do something on a limited base on a small amount of time, earn some hobby income, $400 or $500 a month, and prove that that works for you and your situation. So that concludes it. So as a reminder, when we're done, you'll get the links in there. And invite you to, if you haven't already, submit your question to Nadine, and Nadine will drop a link and you can come join us.
Yep. So I am also now posting the link for those of you who wants to join us live and ask your questions directly.
Yep,
I'm putting that both in Facebook and YouTube because we have audience both on those platforms. So
yep. And
anyway, Brian, we do have a couple of questions here while we're waiting for someone to join us live. Someone said here, I've never heard of a center for independent living before today. Are these programs only for people with very low income, or can someone just receiving SSDI still qualify for some of them?
uh, it's for It's for Social Security disability recipients and low income. Now, there's respective programs in there. So, like, if you're going to apply for like financial assistance for fuel assistance, I fully expect there's an economic threshold. So, and that would be yes, it's only for certain people. But the housing piece that you're looking for is something, for example, that in my understanding in my 2 decades of doing this has worked for everybody.
Okay. All right. Next question here. I'd like to earn a little extra income, but I'm honestly afraid of making a mistake and losing my benefits. What's the first thing someone should do before accepting a job?
Understand the regulation and get at peace with making money, and that it's going to be all right and that you're not going to lose your benefits. That's the first thing. Um, and then the second thing is, you know, I think if you haven't worked, another thing to consider is putting your body in non-work activity so that you can demonstrate to yourself that have a chance of succeeding. That could be volunteering, and doing different things where you've got to actually get up, get out, be somewhere, do something. And you could do that in conjunction with your um, job search so that you can gain some confidence.
Okay. Thanks for that. Another question here. Brian, I was approved a few years ago. Is it worth reviewing my benefits again? Or if I wasn't told about something back then, does that mean I don't qualify?
You should review your benefits every year. Right, start thinking about it now, and then the best time to review them is late September, early October. That's a long time. Benefits, like I mentioned, change every year. So are you missing out on something? I don't know. I don't know your situation, but yeah.
Okay. Another question. If Medicare says a medication isn't covered, does that automatically mean I have to pay for everything myself?
No, we talked about two different options. I mean, I would look into prior authorization and the patient assistance program. Um, and yeah, and hopefully that will work. Yeah. There's other like there's discount medication programs, but typically for like tier 3, 4 medications, it's not going to put a big dent in it.
Mm. All right. We have quite a long question here from one of our audience in YouTube. He said the SSA portal Oh, by the way, there's a disclaimer. I would really appreciate your insight here. Obviously, I will contact the OHO. Here's the question. The SSA portal shows this hearing update. What could be the reason? Why wasn't an alternate date set as of this? ALJ postponed or canceled your hearing scheduled for September 2026. If it's a scheduling issue, why not just set a new date? The notice provided no additional info. Also, this line from the notice is puzzling, as I didn't request a postponement. Where's the second part? No further postponements will be granted unless you have compelling reasons.
Uh, and so the first word I heard was canceled. Is that right?
Postponed or canceled. That's what he or
Yeah.
she said. Yeah.
They don't give you a lot of information to go on. I'm going to take the optimist route. I've seen this happen before when a judge has looked at the file preparing for the hearing and approved the case, canceled the hearing. So I'm in hopes that it's that one for you. But if it's not, it could be God knows what, right? I don't know where you're at with doing this on your own or with a representative, but um, I would ask a representative to look into your case file and see if there's any indication as to why. The other thing you could do is you could contact the hearing office and ask for a written explanation as to why. Those are a few ideas. Yeah.
All right, we got a question here from Amy. She said, I asked this in TikTok, but I'll also ask it here. I'm on year 4 of trying to get disability. How long do they pay for back pay? Will I get all 4 years back? Michigan, if that matters. She's in Michigan.
If this is a continuation of a case that has been going on for 4 years, based on the information that you're sharing with me, then you could possibly get all 4 years, which would be a nice chunk of change. It is possible. Yep.
All right. So we have Dean in the room for our Q&A. Hi, Dean. You are on mute. I'm going to ask you to unmute. There.
Oh, I just logged in now, so I'm just catching up with the presentation.
Okay. So are you
Any
here to
questions?
ask a question or are you just here listening to the presentation, like
Uh,
joining us?
uh, Listening, but I'm sure a few things will pop up that I have questions about.
All right. All right. Welcome.
Thank
That's
you.
yeah.
All right. So anyway, Dean, are you also watching us live on YouTube right now? I'm just gonna put you in the waiting room and then let me know if you would have questions and then I'll let you in here again, okay?
Oh, thank you so much.
Okay. All right, let's see if we still have more questions here from our audience. We have a question from Greg. He said, my hearing was a week ago and it's already in step 4, non-medical review. Is this a good sign?
Gonna go with yes. I'm in an optimistic mood today. Yeah, if you pass the medical review, if there's an indication that you've done that, that's the hardest part. Now they're looking at like your work history, any offsets.
Right. Next question. While working while on SSDI has to include an under, oh, it's not a question, it's a statement. Working whilst on SSDI has to include an understanding with your employer. They have to be on board with the SSDI regulation. If you withhold this info, it will not work. Would you agree with that, Brian? With that statement?
Um, I mean, kind of. I think really ultimately it's up to the disability recipient. It's not up to the employer to know the regulation, to know like So for example, if you have a job and you take it and it's part-time, ideally, and you're earning $800 a month and you're pushed by your employer to work more so that it puts you over the limit, it's your responsibility to set your boundaries and understand what your limits are, or if you want to go over, what the risk is. Yeah. I wouldn't rely on anybody else but yourself. That's just most employers. I've talked to employers in my own like social circles and others that don't do this work about working with and hiring disability recipients. And I haven't met one that in advance has any idea what the regulations are. So I wouldn't trust that based on, you know, my experience. Trust yourself.
Trust yourself, guys. So another question here, Brian. I'm 59 and in the quote unquote not likely to improve category of disability. My only CDR was 10 years after initial um, acceptance. Do you think I will be getting another CDR before full retirement age?
That's a really like even if I had the crystal ball, but let's say yes. I'll
Okay.
just go with yes. Let's just say it's going to happen, right? My take is that you're concerned about getting it because of your benefits, and you're at 59, and so you probably have, I don't know, let's say it's 67 as your full retirement age. So it's during that period. I've had people that have reported 64 getting reviews. There's been people trying to get benefits 64, 65. It's been hard. So here's my reason why I say that is this. Um, I am a firm believer that you should focus on controlling the controllables, not when you're going to get a CDR. And what the controllables are you going to the doctor, communicating the information that you have been keeping in your journal about your limitations to your doctor, like how long can you sit, stand, bend, stoop, in quantifiable measurements so they're really clear and defined, then making sure they're in the medical records. If you do that, you don't have to worry about anything. And it's okay if some of these conditions improve or change. I mean, that's actually fine. But as you advance in age with your disability benefits, your disability qualification related to your ability to return to work, it goes more in your favor. So if you got approved when you were like 45 and now you're 55, it's a different deal at 55 to get approved than it is at 45, is what I'm saying. So um, I'm in hopes that this finds you finds you find this helpful and others, because I know a lot of people, and rightly so, are super concerned about the losing their benefits, and 133,000 a year do. So just do the doctoring.
All right. Now there was a follow-up question from earlier regarding working while on SSDI about letting your employer know your limitations under which you're working. Um, he said, I think no matter what the SSA regulation says, working can still be used against a recipient. He's asking for your thoughts on that.
Well, I don't know. In my opinion, no. I'll express it this way. So we've been doing the Disability Digest business model for 20 years. And the first year when we started hiring disability recipients. And we have at any given time, you know, like 30, 40%. We've had up to 60% of our team as disability recipients. By the way, we have openings if anybody is looking to work. Here's why I say that. Nobody has ever lost their benefits. They've all worked within the allowed amount. And some have had reviews, which everybody does, but it's the regulation. So there isn't, I mean, people can share, there isn't anything in the regulation that's black and white that we'll share with you at the end that says, it's kind of frowned upon. Social Security is actually looking for you to, they would like to see you work, to contribute, to put more taxes back in the system. So that's my opinion from experience and from the regulation. No frowning.
All right. So another question here related to our topic earlier, Brian. If someone is struggling with groceries, transportation, utility bills, all at the same time, with all the extra benefits that was discussed earlier, where do you recommend someone should start first?
Yeah. Um, well, I mean, for us here at the Disability Digest, you can request a benefit review. As a member, if you're approved or if you get access, you get invited to do a benefit review. So that's one. However, we have a real long waiting list right now, but if you request it, we'll put you in the pipeline and we'll do our best to get to you. Starting in September, late September, we will do some events here teaching you how to do more in-depth reviews, like to take the notice of change that you have, um, and look at your current benefits that you're on, evaluate the conditions that you have, the things that I talked about. So that's another thing that's a sure thing. Um, so yeah, and that's why we're doing this because a lot of people are struggling. The cost of living has been, I'll just say different. Um, and in hopes that this will help you out and find some relief. So in the meantime, I'd contact your local Center for Independent Living and see what they have that's available programs right now before you have the opportunity to review, change your program, your Medicare program.
All right, thanks for that, Brian. Now we have another Social Security disability process related question here. Um, it said, Nadine, please ask Brian. I'm in the appeal phase of my application. Is there a timeline for any further updates?
I'm not sure I understand that. If you're in the appeal, like what would an update be? Like, if it
Oh,
means that, if it means can you update evidence in your file,
I
then,
think she's asking for like when she'd receive an update from Social Security because the second part of the question, whether it be for a trial or a denial, something like that. So,
uh, well, the best and most current place to find the status of your case is in your online account. And usually when a case is at a step, they'll give you an estimate of days that's there. It's probably not something you're gonna want to see, but they just do their best to tell you. And I don't know where you're at in the appeal process, if it's a reconsideration or request in a hearing, and that's gonna vary. That's gonna change the wait time because the wait time for hearing is actually quite low compared to what it's been historically, but the wait time for the initial and the reconsideration is not. That's where there's still a significant backlog. But here's my point. If you're waiting is one thing, but you're waiting and you're not approved for a reason. So I would make sure that this is my take, that you have a case that can get approved. And having a case or the conditions that can get approved is one thing. But having the evidence in your file that shows that you qualify is another. I want to repeat that. This is really important.
mhm.
And this is the same for everybody. You can have atrocious conditions and in a situation because of your sickness or an injury that you just cannot work. But when Social Security or other benefit companies go and they look at the evidence in your medical record and they see just the diagnoses, like I have degenerative disc disease, I've got a rotator cuff, I've got mild depression, and they don't see any limitations that say that this individual can't stand for 20 minutes, can't sit for 15 minutes, is only sleeping 4 hours a night, gets agitated after 10 minutes of being around a supervisor and blows up and throws their coffee at them, things like that, then that's what you need to get and keep your benefits. So if you're not there yet, that's where the work that we do when you join us at the Disability Digest, we take the time to understand your situation and get you into the resources that you can use after we have helped you understand how to communicate the limitations associated with your diagnosis. Absent of that, you're in that gap of 1.9 million people apply and 687,000 get approved. That's the gap, and that's why.
All right. Thanks for that information, Brian. Another question here. I think this is the last one from our audience. Does COLA affect any of us receiving benefits annually? I
Oh,
only ask because I have a dental surgery scheduled next month and I have to figure out how to finance it and pay off a loan ASAP.
okay. I don't see, it's not clear to me how it would impact that instance, but I'll give you a situation that happened a few years ago where we had a cost of living increase of like 8 point something percent. Um, And what that did is individuals that had a check at like $1,680 a month, I'll use that as an example. So they got the 8% increase and it put them over the $1,710 limit, which put them in a situation where they were getting their Part B paid for and now they have to pay for it. So the net was they ended up losing money because of the cost of living increase. So that is something that can happen because it's a needs-based program, and as your check increase, it could bounce you out of programs.
All right. So yeah, thank you so much, Brian. Those are all the questions that I have today, and I will now be posting all the link and resources
Yep,
that Brian mentioned earlier. So
yep,
I
yep,
hope you would all find these helpful.
yep. Great. And that's just some of them. As I go through this event, I'm thinking, oh, maybe we should have covered that. But anyway, that's a good start for you. Hopefully, you have grasped the concept that there's more that you are possibly entitled to out there and to take action and to capitalize on that. And, the first step, depending on your situation, but a good logical first step would be Center for Independent Living, and then start thinking about reviewing your benefits as we get closer into late September, early October. Um, in 2 weeks from now, we will be back. We're going to have an event about how to use the current technology tools to help you get your benefits approved and to keep your benefits. One example that I could directly parallel to today is let's say it's housing, right? So you can come up with the general guidelines of what your wish list is, your housing list. And you can use a free AI tool to craft a letter that you can send in to your local Center for Independent Living, address it to what do I want to say, the person that runs that organization, because you have all that information that we provide for you, and then you follow up on that. That's like an easy to use resource. We'll teach, even if you haven't used any AI tools before, we'll show you how to do it so that you can do that. And there's other applications as well. There's actually a lot of applications for it. So, but AI isn't the only thing that we're going to talk about. So in a couple weeks, mark your calendars, come on back, and we'll help you out with that. So Nadine, thank you for your assistance today. And
Of
everybody else,
course.
I hope you're safe and enjoy your these glorious days of summer wherever you may be. And thank you for attending the 386 people that are out there. Appreciate you taking time out of your
Mhm.
day. All right.
Thank you so much, everyone.
All right. God bless. Till the next time. Be well.